What if we've been thinking about obesity all wrong? Seriously, what if it's not really about willpower, but instead a complex, chronic medical condition? Well, today, we're going to explore a whole new way of understanding and treating it, looking at obesity through the lens of modern medicine.
And it all starts with a really simple, super common question that, millions of people ask their doctors every year. We're going to follow the story of one patient, we'll just call him Mr. M, who asks this very question during a routine checkup. So let's meet Mr. M. He's 45 years old, has a history of knee osteoarthritis and some acid reflux. For the most part, he feels pretty good, but he's noticed he's getting out of breath more easily, and he's just worried about his weight. And that simple concern? It's about to kick off a surprisingly deep and complex diagnostic journey. So, how does a doctor even begin to answer Mr. M's question? Well, the first step is something we all know, the scale. But as we're about to see, that number, it's just the very beginning of the story. The real diagnosis goes way, way deeper. For decades, the go-to measurement has been the body mass index, right? BMI. It's a fast screening tool, but it's got this one huge flaw. It has no idea what's muscle and what's fat. A way more useful measure for an individual's health is something called adiposity, which is just the medical term for excess body fat, because that's what actually drives health risk. So how do you measure adiposity in a typical doctor's office? I mean, sure, an MRI scan would be perfect, but that's not exactly practical. Instead, clinicians use a simple tape measure to check waist circumference. It's cheap, it's easy, and it's a surprisingly powerful way to get a handle on the abdominal fat that's linked to so many health risks. Okay, so for Mr. M, the scale and the calculator give him a BMI of 33.7. According to the charts, that puts him in the Class 1 obesity category. But remember, this is just a screening tool. It's like a flag on the play, but it doesn't give us the full story yet. And here it is. This is the crucial piece of the puzzle. Mr. M's waist circumference is 42 inches. Now, for men, anything over 40 inches points to an increased health risk. So, this measurement confirms he has excess adiposity, not just a high BMI from who knows what. The diagnosis is now crystal clear. So, with that diagnosis confirmed, the real work starts. The next step is to take a deep dive into Mr. M's overall health to understand all the different factors at play. And let me be clear, this isn't about judgment at all. It's about building a complete 360-degree picture to find the best path forward for him. A modern obesity evaluation is incredibly thorough. I mean, doctors look at everything. They review medications that might cause weight gain, they assess any related medical conditions, they screen for things like depression and anxiety, and of course, they take a detailed, non-judgmental look at diet and physical activity. It's truly a holistic view of the whole person. So for Mr. M, this evaluation was really revealing. Turns out he wasn't on any medications known to cause weight gain, and his mental health was in a good place. But here's the crucial part. He was highly motivated to make changes. He actually told his doctor he would do anything to improve his health. And that motivation, that's a huge, critical starting point. Okay, so now we have a full picture of his health. We can finally move to the treatment plan. And this is where the modern approach has just completely evolved. It is no longer a one-size-fits-all recommendation. The treatment is tailored specifically to the individual's health complications. The foundation for literally everyone is something called Comprehensive Lifestyle Intervention, or CLI. And this isn't just your typical eat less and move more advice. No. This is a structured program that combines nutritional guidance, a physical activity plan, and really important behavioral strategies like goal setting and self-monitoring to support lasting change. And this right here brings us to one of the biggest, most important shifts in modern obesity medicine. The intensity of treatment is no longer based on your BMI number. Instead, doctors now use a staging system, where the stage is determined by the presence and severity of any obesity-related health problems. This totally changes how they decide on the urgency and the type of treatment needed.
So here are a couple of common staging systems. Let's just look at the AAC system on the right, which is used a lot. Stage 1 basically means a person has obesity but no known complications. Stage 2 means they've got one or more mild to moderate complications, and Stage 3 means at least one severe complication. Now, since Mr. M has both acid reflux and knee osteoarthritis, two conditions definitely made worse by excess weight, he gets classified as AAC Stage 2. So, what does being stage 2 actually mean for Mr. M's treatment plan? Well, the guidelines are pretty clear. He should absolutely start with that comprehensive lifestyle intervention we talked about. And this is a big but. Because he already has health complications, it's also recommended to seriously consider adding medication or pharmacotherapy to his plan. And wow, the effectiveness of these medications has just exploded recently. As you can see, older oral meds might get you about 5 to 9% weight loss, but the newer injectable medications, they're in a whole different league. Semaglutide is showing an average weight loss of 15%, and tirzepatide is up over 20%. This is a genuine game changer in how we can treat obesity. So this brings us to what might be the most important part of reframing obesity. Why is ongoing treatment so critical? Well, it's because we now understand that obesity isn't some temporary problem you just fix. It's a chronic disease that needs to be managed for the long haul. I mean, just read this statement from the Yale curriculum. It's incredibly direct and powerful. It suggests that just like you would with medications for high blood pressure or diabetes, these treatments aren't meant to be a short-term fix. They are designed for long-term management of a chronic condition. So the big question is, why? The Step 4 trial gives us a pretty stunning answer. In this study, everybody took semaglutide for 20 weeks and lost about 10% of their body weight. Great. But then, half of them stayed on the drug, and the other half were secretly switched to a placebo. The results were just stark. The group that kept taking the medication lost almost another 8% of their weight. And the placebo group? They regained nearly all the weight they had lost. What this shows, clear as day, is that the body has incredibly powerful biological mechanisms to defend its weight. The second the medication stops, those mechanisms kick in and fight to regain the lost weight. This is some of the strongest evidence we have that obesity is a chronic disease, one that requires continuous management to maintain any health benefits. And that leaves us with a really profound question. If we accept the science that defines obesity as a chronic, relapsing disease, just like we do for so many other conditions, does that mean its treatments, whether they're behavioral or pharmaceutical, should also be considered a lifelong commitment? It's a fundamental shift in perspective, and honestly, it changes everything.